everyone. Thanks for joining us on Chicago Tonight. I'm Brandis Friedman. Here's what we're looking at. Prozac, Lexapro, Zoloft, just some of the antidepressants federal health officials are working to wean Americans off of. And hundreds of thousands of Illinoisans and the stores that feed them are bearing the brunt of SNAP cuts. First off tonight, Chicago Public Schools board members are calling on state lawmakers to help fill the district's $730 million budget gap.
We saw the difference between having that additional COVID funding and our students really flourished. The numbers went up, the scores went up. Turns out CPS has been underfunded for decades. That's right. And we need more money.
Just yesterday, CPS officials announced plans to cut staff at schools across the city this summer in efforts to close that budget gap. They say the deficit is driven by a lack of state and federal funding as well as dwindling enrollment. Board members, both elected and appointed by the mayor, say the state has failed to adequately fund the district according to the evidence-based funding formula. They specifically cite a proposed bill that would overhaul the state's property tax laws in favor of mega developments, such as a new potential Bears Stadium in Arlington Heights. A pilot program to respond to people in mental health distress is going citywide. The Crisis Assistance Response and Engagement, or CARE program, has already been operating in 6 police districts, but is now expanding.
Mental health does not happen in a vacuum, right? Mental health is public health, of course, but mental health is also public safety, right? It also relates to youth development. Mental health relates to resource allocation or a lack of resource allocation, right? And I think the thing about this program that is so beautiful is that with us being integrated into the city system, we can better serve our clients.
City officials say the program deploys trained behavioral health professionals and EMTs to help people in mental health crises or socio-emotional distress. Additionally, care teams can now serve a broader range of residents, including youth as young as 6 years old and adults over the age of 65. The teams only respond to non-violent, non-medical situations where there is no active safety threat. Residents can still dial 911 to request a care team. There's a new addition in Kane County's bison herd, and it came as a bit of a surprise. 6 bison were released onto Burlington Prairie back in December, and one of the newcomers was hiding a secret. Well, it's out now. On May 9th, one of the herd's females gave birth to a calf. Officials estimate it's the first baby bison born on tall grass prairie in the county in 200 years. In a unique arrangement, the bison roam on land owned by Kane County Forest Preserves, but the Chicago-based American Indian Center owns the bison, though they prefer the word steward. The center plans to offer bison-related programming later in the summer. Burlington Prairie in Sycamore is open to visitors daily from sunrise to sunset. Up next, the MAHA movement targets SSRIs right after this.
Chicago Tonight is made possible in part by the Alexandra and John Nichols family, the Polk Brothers Foundation, and the support of these donors.
Health and Human Services Secretary Robert F. Kennedy Jr. is creating a plan to reduce the number of Americans on antidepressants. He, along with others in the Make America Healthy Again, or MAHA initiative, claim the country has a problem with overprescribing psychiatric medications as the first line of defense against mental health conditions. Instead, they want to emphasize holistic remedies like talk therapy, exercise, and healthy eating. Joining us now is Jim Poole, Senior Director of Policy at the National Alliance on Mental Illness in Chicago. Jim, thanks for joining us.
Thanks for having me.
So RFK Jr., he's been openly critical of selective serotonin reuptake inhibitors, SSRIs, for a while, stating that the drugs are harder to wean off of than heroin and partially to blame for mass shootings. Not sure that there's a lot of research to back those up there, but are these something that we should be looking at more critically?
So I think it's important to note that the research does not show those things that have been attributed to the secretary, right? These are very common medications. They've been around since the 1950s. They're very well studied over decades. There are certainly side effects with every medication, but we shouldn't be painting with a broad brush. And I think our concern at NAMI Chicago is that this reinforces sort of a medication stigma that people might feel, that there's something shameful about using a mental health medication. And we know from our conversations every day that it's a really important tool for lots of folks in their recovery, and it's life-changing and life-saving for many of our neighbors.
To that point, do you think are Americans overprescribed SSRIs?
I think no, I don't think that. I think that the last statistics I saw from 2024 were that about half of those diagnosed with a mental health condition in the United States did not receive treatment in the previous year. So I think we have a tremendous gap in our care system in this country. There are many communities that don't have access to mental health care, either not because it's not affordable, you can't transport yourself to it, right? There's that going on. So I think overprescribing, there's maybe something to talk about in some niche of our system, but I'm not sure there's any argument to be made that what's happening in America is too much health care writ large.
Yeah, so at MAHA's Mental Health and Over-Medicalization Summit last week, RFK Jr. Talked about the country's mental health crisis.
The United States does not just face a mental health crisis, we face a dependency crisis driven by over-medicalization. This is a system-level pattern. Too many patients begin treatment without a clear understanding of the risks and how long they will stay on these drugs or how to come off of them. And that's not informed consent. We are going to fix it.
What's your reaction to the Secretary's comments?
So I think everyone should have informed consent right before they begin a medical treatment. So to his point that everyone should be informed about possible side effects, right, contraindications of medication, we are 100% in alignment with Secretary and Kennedy on that. However, that's the case for any medication, and sort of painting with a broad brush over SSRIs is not responsible and not really found in the medication, I think, and in the literature. I think he's also talking about dependency there, using that word. And I think there is something about community that's very important to recovery and to all of us as people. And I think part of the reason we're having a mental health crisis is that we're seeing more loneliness, more social separation, less connectedness as a community, people struggling more with having more stress. And so I think that's also that's a huge driver of this. So I wouldn't just put it on an individual medication. That's sort of irresponsible.
What authority does, at the same time, this is the federal government, so what authority does the federal government have over prescription drugs?
So the FDA is the regulator of prescription drugs in the United States, and so they act based on evidence, right? So the FDA works on what the Secretary would call gold standard evidence, right, in research to figure out what is the best way to advise the public on medications. And so the FDA certainly has a role here. They should be grounded in science. We don't want it to be grounded in rhetoric, in opinion, in what we think. We want to make sure we're having science and research-based clinical decision-making on all of this.
The department has said that it plans to develop guidelines for doctors to help with weaning patients and changes to insurance billing, which that's going to raise some eyebrows.
Sure.
Do you have any concerns with the potential changes that could be coming on board? I'm
very concerned about people losing access to their medication arbitrarily, right? And so I think any kind of blanket ban is certainly of great concern to us. There are good reasons to pursue sort of better standards and better clarity on best practices for weaning people off of medications and avoiding discontinuation symptoms. Those do occur. People do come on and off of these medications, and so there is good reason. I mean, like everything else, he is making a point that is there, which is there is grounds for research here, and we do have to continue to develop and continuously do science to improve mental health care and the medications we're providing. As you mentioned, and as the Centers for Disease Control and Prevention have also said, we are in the midst of a mental health crisis in the United States. Nearly 17% of American adults currently take SSRIs or other antidepressants. Prescription rates generally increase with age, with just over 19% of adults over 60 using these medications. And in 2023, 40% of U.S. high school students reported persistent feelings of sadness or hopelessness. What are the factors, Jim, that are contributing to these rates of depression and anxiety? Oh, I wish I had a clear answer for you, Brandis, but it's many things altogether, right? So there's been lots of hypotheses. One is, I think that we have social media, technology changes that have kind of brought more content into the eyes of young people, and perhaps creating more stress, more inputs that are negative. I think we're also just better at talking about mental health in some ways, and we're acknowledging it more, certainly than 20 years ago when I was turned 20 or 30 years ago when I was young. And I think some of that is we're identifying more young people are speaking up more about it, and that part is good. But I do think we are seeing like a higher prevalence of these things also because of economic stress. The K-shaped economy is hitting lots of folks. The more stress people have, the more that accelerates any kind of mental health challenges they're having.
As mentioned, the MAHA movement prioritizes natural or holistic remedies to treating mental illness, like nutrition, physical activity, social connection. Lifestyle changes, can those be substituted for medicine, for chemical changes?
Certainly not. They're not a substitute in any way. They can be enhancing to mental health care, and many people find them to be helpful. And I think that there's a lot of literature around movement and mindfulness and things that can be really healing and restoring for people, but they are not a replacement for medication when that's needed. And I don't think we should be shaming folks for using a medication, pursuing medication, exploring it. It's a very useful tool, and for lots of folks that I've talked to, it's life-changing, life-saving for them, and they would not know what, they're honestly quite nervous that it's going to be taken away from them arbitrarily here.
What do you say to people who use these medicines? What should they know to either ask their doctors as the federal government starts to move forward with this, and what should they know for themselves?
I think they should know that it's a process for this to happen. They can't just summarily ban medications, and so try to throttle some of that concern. But I would talk to your doctor about your concerns you have and think about how you can stay on them. I don't think there's any near-term concern, so nothing really in the next year probably, but hopefully those of us in advocacy will work hard and we can all speak out and defend from some kind of attempt to ban these medicines.
Okay, Jim Poole, thank you so much for joining us. We appreciate it.
Thanks for having me.
Up next, the ripple effects from cuts to SNAP benefits. Major changes to the Federal Supplemental Nutrition Assistance Program, or SNAP, mean an estimated 120,000 Illinoisans or more are at risk of losing those benefits, formerly known as food stamps. But the changes aren't just hurting people who use SNAP to feed themselves and their families. Some say they're also hurting grocery stores and beyond. Joining us now are Italia McCarthy, General Manager of the Dill Pickle Co-op in Logan Square, Elizabeth Abuno, owner and operator of 40 Acres Fresh Market, and Nolan Downey, Senior Director of Policy at the Greater Chicago Food Depository. Thanks to all of you for joining us. Appreciate it. Nolan, I want to come to you first. How do we think SNAP cuts are impacting grocery stores, bottom line?
Well, so these are the first real impacts that we're starting to see as a result of the so-called One Big Beautiful Bill that was passed last summer. That bill contained $200 billion in cuts to SNAP, another $1 trillion in cuts to healthcare programs like Medicaid, and we're now starting to see not only the primary impacts, as you mentioned, 120,000 people losing benefits just this month, but we're now starting to see some of the secondary consequences, not only to businesses, but to whole communities and indeed the entire state economy. SNAP brings $4 billion into the state. That $4 billion generates another $6.6 billion in economic activity. This program is a load-bearing pillar of society, and if it's weakened, we are all going to feel it.
Tell me a little bit about the ripple effect. We've heard reports that vendors that work with grocery stores, for example, that serve SNAP beneficiaries, they're also experiencing the pain.
There's no question. I mean, this program is big enough that it not only provides critical assistance to recipients to supplement their grocery budgets, but it provides critical revenue to grocery stores, which is not exactly a huge margin business. It also supports jobs. We're talking about thousands of jobs across the state and across the country. So again, this is really something where even if somebody is not on SNAP, the program being weakened to this degree at the federal level is something that we're going to feel both in the grocery sector, the retail sector, but also across the entire state economy.
Italia, what's been your experience?
Our experiences, we have about 20% of our sales come from SNAP beneficiaries in our grocery store, and including a lot of our staff who are participating in the SNAP program as well. And we've definitely seen a decline, but we've also seen uplifting from the community for making sure that we're supplementing some of these cuts. So we're doing a lot more mutual aid programs in our store. We have a grab bag donation where you can buy $10 worth of groceries that go to a food pantry that we also have a lot of our SNAP beneficiaries educated about where those are at in case they need supplemental food. But like those are the types of things that we're seeing in our grocery store.
Yeah, tell me a little bit more about some of those and how you're able to sort of implement those programs, you know, and still allowing folks to, you know, maintain their dignity, but you're also sort of providing and supporting the community.
Yeah, so we have our needs-based owner program where anyone who has SNAP or has some type of hardship in their life, they can apply and become an owner, and you get 10% off all of your groceries. Also, we have our Link Match program that is provided by the state where you can get up to $10 worth of Link Match dollars when you use your SNAP card at the store to purchase fresh produce. And that's all free grant money that we receive that they can participate in as well. And yeah, those things have been working really well. We've seen an uptick in people signing up for that program, and that's been helping a lot, I think, in our community.
Liz, tell me a little bit about 40 Acres. You all haven't quite started to see the impact just yet?
I think that when you're in your first year of operation, you're just trying to figure out what your trends are and what your patterns are. 1 month, SNAP could make up 10% of our revenue. The next month, it could make up 15. And so what you're looking for is a 12-month average, and we've only been open for 8 months. So it's really hard to get your bearings when the ground beneath you keeps shifting every 2 to 6 months.
Okay, and I also want to bring in, we've got a new player joining the band. We're also now joined by Melody Winston, Senior Director of Living Fresh Market in Forest Park. Melody, tell us about how SNAP cuts, how they're impacting the bottom line there.
Well, they're impacting us in a few different ways. Not just the 15%, of the sales that we see daily from our SNAP recipients, but also our vendors who are first time on the shelf in a grocery store. And they're seeing maybe less purchases made for them, so that's less money that they get to take home to their families. So it's a ripple effect, I call it.
What are some of the different steps that you all have taken to sort of sustain local independent grocers, or what are some of the different steps you've taken?
Well, we have to get lean sometimes, and that's just a part of business everywhere, no matter if you're a grocer or you're selling shoes or whatever the case may be, but you got to get lean in a few different ways, and one might be the hours that your employees work a day, and you want to cross-train now, and the cashier might start going and helping in floral, or there's some shifts that you have to make, and I call it a pivot, because it doesn't have to be necessarily a negative thing, but it can positively impact the business so that you continue to thrive through these times.
Right. And of course, Italia, we just heard from you about some of the different ways that the co-op is able to support people and help them still get access to food. But Nolan, give us a sense of, what it takes to sort of make up the difference, and if it can be made up.
I mean, I first and foremost just want to applaud all the efforts of everybody, because I think it's incredibly heartening in this moment to see retailers stepping up, philanthropy stepping up. But we've got to be clear, this is not going to be enough in this moment. It's part of the reason why we're really asking for the partnership of state government. If the federal government is going to be abdicating its responsibility to provide for people's basic needs, what can we do at the state level? It's part of why at the Food Depository we're convening the Save Our SNAP Coalition. It's a coalition of, as of today, over 100 organizations that are statewide working to advocate for policies at the state level that can make a real impact for people now. A couple of those being emergency assistance for people that have lost SNAP. Another being expanding existing state programs to bring in some of the populations that have lost access to these critical benefits. These are steps that we can take now and that we can afford, and we must take if we don't want hunger to grow unchecked in our communities.
You all have estimated that 120,000 people could stand to lose their SNAP benefits, including 16,000 immigrants and refugees who have legal protected status. If that is the case, if these folks, start sort of, falling off the rolls, are they ineligible to reapply for benefits? What options do they have?
So those 16,000 humanitarian immigrants, they are going to be ineligible in a way that is ongoing. Wow. It's part of the reason why some of that expansion of programs to bring some of those folks in at the state level is critical, and that's a population that's very vulnerable and really needs that assistance now. As for those 120,000 people that lost because of expanded work requirements, there can be a path back to the program. And so what we really encourage people to do, first and foremost, find out if you're exempt. Many people should be exempt from the work requirements. There's a screening tool on the state's website that people can go and access to see if they meet an exemption. If they do, get that information to the Department of Human Services right now. But I think we have to recognize not everybody's going to meet an exemption. 120,000 people, surely some of them have lost access to benefits in a way that's more ongoing. So what can we do for those people who now are in crisis?
Melody, tell us about some of the programs and events that your store has created and laid out to help people still gain access to food while maintaining their dignity.
Absolutely. We've started the 60-second shopping spree, and it's turned out to be a bit of an amazing event that we have where community can sponsor and donate for these shopping sprees, and we can have people who come in once a month on the last Saturday of every month, and they come and shop. They get a raffle ticket, they sign up for our Fresh Rewards program, and then they're off to the races. So it's really a great time to see how people can get food on their tables, and then they end up sharing with their family and other households, so it ends up being a good thing on all sides. It's a win-win. But also this weekend we have the Good Neighbor Day America at Living Fresh Market. So in Forest Park, we ask people to come out and do something good for a neighbor. So we'll be giving away 500 bags of groceries to people who come, and feeding and clothes and those sorts of things.
I tell you, why is it important for people to be able to receive food assistance without shame?
It's extremely important because food should be accessible to everyone. I mean, that's our motto at the co-op for sure. And I think it's important as all of us humans to be humanitarian towards one another, That's what makes us a great community. And I think Chicago has really stood up, as far as what's been going on in the world right now. I think we're doing a really good job at it. And it's really fun to see all the things that what you're doing at the Food Depository and what you guys are doing in your market. It's really important stuff that we're doing.
Liz, what are some of the other challenges that you experience with running a grocery store? Especially one, she laughs, especially one as young as yours, I'm sure. Sure, all of you can relate. Yeah, not that much, but go on.
So I think that as a brand new grocery store, one of the things that you're always competing against is inertia, and that's it's easier for people to always do what they've always
go to the store they always go to.
Yeah. So bringing that awareness and attention that you are there, drawing people in, learning how to operate a store when you've never done it before. But the pressures of grocery are constant. Labor is an expense. Inventory, a lot of things you have to pay cash on delivery. So just keeping your shelves stocked, spoilage. You're constantly chasing dates and culling and making sure that your shelves are fresh. So it's a constant business. I don't sleep. I don't know when the last time I had a good night's sleep was.
I thought it was just me.
Yeah, it's hard, and you don't know when it's going to turn around, and you try things, and sometimes you have to wait to see those results. But you just try to get better every single day.
Certainly not for the faint of heart. There is a new bill being introduced in the state called the FRESH Act. It stands for Families Receiving Emergency Support for Hunger, that if passed, it would provide one-time $600 payments to those who lose eligibility for SNAP. Nolan, we've got about 30 seconds left. Is this just the first step? What else would ease the burden?
This is the first step, but this is one of these interventions that we can afford that will make a real difference for people now. Again, the federal government has created this situation, but at the state level, we have a responsibility to do what we can to step up for people. And I think this moment just listening to folks around the table, all the hardship that is created by this can be a very dark time for our communities, or this could be our finest hour as a state. We need to step up, and we need to do it now.
Do you know the bill's status, likelihood of passage?
Well, listen, I mean, anything that costs money in this state is an uphill climb, but I'll tell you, the state's going to spend money on something this year. I find it hard to find a priority that's more important than feeding people who have just lost access to critical assistance.
All right, we'll have to leave it there. Thanks to all of you for the work that you do and for joining us. Melody Winston, Italia McCarthy, Nolan Downey, and Liz Abuno. Thanks, everyone.
Thank you. Thank you.
And that is our show for this Wednesday night. Check out our website for our Chicago Summer Festival Guide. From street fests and art shows to outdoor concerts and cultural celebrations, we have got you covered. It is all at WTTW.com/festivals. And join us tomorrow night at 5:30 and 10. It is at the center of a deadly cruise ship outbreak. But what is the hantavirus and how is it transmitted? Now, for all of us here at Chicago Tonight, I'm Brandis Friedman. Thank you for watching. Stay healthy and safe, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm that serves the needs of clients in the Chicago area and throughout the nation.